So in the final rule, these are the providers that are qualified under the program. So first, you must be an office-based physician. You have to, as I said, be using a certified EHR and do so in a meaningful way. And we're going to describe what the government has defined as meaningful way. That you could, by the way, if you are using an existing EHR, so all of you do qualify, even though you've already paid your money, you've already bought your product, you've already implemented, you will qualify under this program as long as it's a certified EHR that you're using and you're capturing the right data. There are two pieces to the plan. There's the Medicare incentive and the Medicaid incentive. They're very different. So you need to determine up front whether you want to participate and qualify under the Medicare or the Medicaid. The good news is you can choose to change once. So once before 2014, if you elect to go down one route and you start qualifying under that one route and get reimbursements, you can actually change to the other plan. But you can never get more than the maximum, and the maximum happens to be under Medicaid. You could never actually get more than the maximum incentive under Medicaid, which is the $63,750. We are going to talk about the specifics of each of these, so I'm not going to spend time dwelling on this slide, but I will let you know what they call there's no double dipping. So you do have to choose one or the other, either Medicaid or Medicare. So what is an eligible provider? That's the first key critical piece. So an eligible provider is a physician, doctor of medicine or osteopathy, a doctor of dental surgery or dental medicine, podiatrist, optometrist, or chiropractor. This is under the Medicare provision. These are the providers who are eligible under the plan. Under Medicaid, they extend it to also allow certified nurse midwife, nurse practitioner, and PAs practicing in a FQHC or a rural health clinic. So one of the questions that came up during all the proposed rulemaking, I don't know if any of you are, your practices are actually owned by a hospital, but that was one of the big questions during all of the proposed rulemaking is, would you be eligible since your practice is owned by a hospital, or would you actually fall under the hospital stimulus? And what they ruled was that you are actually eligible unless you are truly a hospital-based physician like an anesthesiologist, pathologist, or emergency care. So that was great news. That was a nice bonus for the docs who have practices owned by hospitals. The definition behind that is that you have to provide substantially all of your services to at least 90% of your services in, not being in an inpatient environment. So if you are inpatient environment, then you're not eligible. If 90% are in an inpatient environment, then you are not eligible for stimulus.